did several years ago, we sponsored next generation sequencing testing for patients who had advanced stage cancer. And the requirement for participation in this was that they go through an advanced care planning process with a trained psychologist or social worker beforehand. And the first 24 patients, 5 of those patients said, you know what, not only do I not want this testing, I don't want any more care. And I think that was an eye-opener to the physicians who were participating in this process, because they thought all these patients wanted additional care. And so I think we make the assumption, the erroneous assumption sometimes, that patients want to continue going, but until we sit down and have a conversation about what's important to them, we make the assumption that everybody wants everything. And understanding what patients' goals are, I think, is critical. And in fact, I think, in the TEML study, we showed that adding palliative care early improved quality of life and longevity of life without necessarily adding more drugs. And that's where I think, as we decide that even the patient-reported outcomes that we measure are defined by the healthcare delivery system. They're not defined by patients. It might be a bridge too far for every patient to define their own outcomes, but if we don't have a system that incorporates or captures patient preferences and goals of care, the likelihood is that we're going to provide more care than a population of patients would want. And again, that's my definition of waste, if we provide more care than patients would have wanted, had they known their options.
I agree. I think education is key, and a good understanding of what their expectation is, and is it really balanced by the evidence?
Yeah.
That, what really is the outcome? Because at this point, for several cancers, even though we've made great advances, we're still not curing cancer.
Yeah.
Majority of them continue to die when they have advanced stage cancer. Do they really understand that that's what they're up against, and what do they get, and what survival? Is it a month and a half? Is it 2 months? A lot of times that is what we're talking about in trials. Patients may not want to go through a lot of those treatments if they really understand what they're up against.
And interestingly, in the TEML trial out of Mass General, they looked at concordance between the patient's expectations and the curability of the disease. These are all patients who had metastatic disease, and those patients who were in palliative care had their understanding was more concordant with reality, that this was not a curable condition. And I think that misperception about is their disease curable may lead them to do things that they might not otherwise do if they knew the real prognosis.
I think all of you have really articulated why patient-centeredness is important to determining what constitutes good care. Lately, we've seen a rush to metricize everything. How do you measure whether or not that care was actually delivered in a way that achieves what I think are really the very human-centered goals that you've articulated? Do we have a way of developing meaningful quality measures or metrics to let us know who does this well, maybe reward them, and who does this poorly and not reward them?
Yeah.
How do we do this?
In the oncology care model from CMMI, one of the measures in the 13-point care plan is the documentation of what the treatment goal is. Is it curative or palliative? And I just think that if, as I just discussed, if there's discordance between what the patient's understanding of that is, of their treatment is, and what the physician's expectation is, that's a measure of poor quality. Because, and it's a very simple one.
Yes.
I don't know how you collect that information from the patient about what their perception is, but I think that's if there is discordance there, then something's wrong. And the likelihood is that we're paying for healthcare services that might not be necessary.
Well, and you raise that question, and it seems that when we look at the nature of the kinds of metrics that people have rushed toward, we see the PQRS measures, which I think are not good when it comes to measuring the quality of cancer care, other than maybe some of the end-of-life measures, which maybe need a little bit more context to be more robust than what they are. But if we look at things like the NQF measures for cancer, do we think that someone who got chemotherapy for breast cancer in 119 days got infinitely better care than someone who got chemotherapy at day 121? Are these the kinds of measures that we want to foster? And, as someone in the payer space or in the health plan space, are these things compelling to you?
Ideally, the measures that you really want to focus on is, are we improving their survival? Are we improving their quality of life, right? Those are probably the best measures that I can think of. And probably patient-reported outcomes are important as well. But I think some of those measures, I think the initial iteration of it where they tried to measure, is pain being quantified? Is it being addressed? I think they are good process measures to start with, but ideally overall in the long run, I would like to focus on true outcomes and understand the value of a lot of the things that we are doing, right? Could be drug therapy, could be surgical intervention, could be a lot of different things that we're doing to the patient and admitting them to the hospital. Is that really adding any value? That's really not quality care. So those, I mean, they started with some reasonable first steps. I think we have a long way to go.
What was that phrase? Not everything that can be measured matters, and not everything that matters can be measured. And I think that's applicable here. When I think about what outcomes we should measure those things that are important to patients, which, not being an oncologist, I would say are probably, am I living better and am I living longer? But rarely in any published clinical trial do we get that information to help inform the patient or the provider. And in the real world, outside of a clinical trial, we're not measuring those for the most part. The handful of practices that are involved in OCM are measuring some health-related quality of life, but for the most part, that's an extravagance that nobody invests in.